We will be focusing on the schedules of drugs, Schedule 1, 2, 3, and Schedule 5 of drugs. Usually it is covered under the Controlled Substances Act of 1970, and different countries have their own respective legislation. So let me proceed. If we focus on the Schedule 1 drug, they have a high potential for abuse, you see, and so far certain terminologies will be used like use, misuse, and abuse. Use is particular terminology used when a drug has been approved by a respective regulatory authority like DREP in Pakistan or FDA in United States of America, and the drug is approved for particular purpose, and that is called as its pharmacological uses, therapeutic uses, or uses of drugs. When it is repeatedly used apart from the uses for which it was approved, then it is called as that misuse of drug exists. And when this misuse is for a considerable period of time, the body's neurobiology is changed, and changing in this neurobiology will lead to some personality disorders. So we can say that the body is now dependent on that, and then we can coin the word abuse. So use, misuse, and abuse. These are three terminologies going side by side. So as we go from Schedule 1 to Schedule 5, so tendency per dependence is decreased. But as we go from left to right, from right to left, so the dependency toward this dependence is increased. Keep in mind this point. So let me proceed. So when we compare again this Schedule 2 drug, they have a high potential for abuse, but it has a medically permitted use. So they are medically accepted. Its use is medically accepted. However, abuse of this drug is associated with either psychological or physical dependence. So and however, so far Schedule 3 drugs are concerned, they have relatively a low potential for abuse as compared to Schedule 1 and Schedule 2 drug. But again, its use is permitted in medicine, practice of medicine, and they have relatively a moderate to low dependence as compared to Schedule 2 drugs. Same is the case for the Schedule 4 drugs, again having a low potential for abuse as compared to Schedule 3 drugs, and they have a limited physical dependence. And same is the case for Schedule 5, which have a chances of limited physical dependence and very low potential for abuse as compared to Schedule 4 drugs. And again, it is accepted for a particular pharmacological action or therapeutic uses. Examples of Schedule 1 are heroin, marijuana, and lysergic acid derivatives, where here is cocaine, opium, morphine, methadone. These are the classical drugs. And if we combine acetaminophen with the cough syrup or antitussive agent or anabolic steroids, then they are placed as Schedule 3 drugs. So the most important thing for you is to understand as health professional, particularly pharmacists, of that drug enforcement agency uses certain forms. And when you receive these Schedule 2 drugs, you see they have a high potential for abuse and dependency. So if you are going to dispose of, you shall report it on Form 41. And if you are going to report the loss of these drugs, then you have to fill Form 106. And for its supply chain and its uses and sale, you have to use Form 222. This is very important. Remember, drugs are a poison, and do not you go for self-medication. Always seek the advice of your healthcare professional. Thank you.